Good evening. This is All India Radio. I am Manoj Singh Rana, and with me is Renuka with the evening news. The headlines. Health and Family Welfare Ministry says government has taken steps to ensure supply of medical oxygen for COVID patients in the country. Prime Minister Narendra Modi asserts all arms of the government working unitedly to deal with COVID-19 situation in the country, urges union ministers to stay in touch with people of their regions and help them. Government permits import of oxygen concentrators for personal use. Principal Scientific Advisor to the Government of India releases home care tips for managing mild symptoms of COVID-19. Bihar government to give special pension to family of those government officials who died due to COVID in the state. Over 15 crore 22 lakh COVID-19 vaccine doses administered in the country so far. More than 2,97,000 people recover from COVID-19 in last 24 hours. Nearly 3,86,000 fresh cases of COVID-19 registered in the country. Andhra Pradesh plans to provide over 32 lakh tap water connections in the current financial year under Jal Jeevan Mission. 44 people killed in a stampede at a religious gathering in Israel. And in IPL cricket, match between Punjab Kings and Royal Challengers Bangalore underway at Ahmedabad. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. The vaccination for the person of age between 18 and 44 would begin from 1st May at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. Now, the news in detail. The Union Government is continuously engaged in supply of medical oxygen to the states and union territories. The central government has said that the government has taken series of steps to ensure the supply of medical oxygen for the treatment of COVID patients in the hospitals. Briefing the media in New Delhi today, Joint Secretary in the Health Ministry, Love Agrawal said over 8,593 metric tons of medical oxygen have been allocated to 23 states so far.
तो 8,593 मैट्रिक टन हमने 23 स्टेट को अभी अलॉट भी की है और स्टेट के साथ कोऑर्डिनेट करते हुए यह ऑक्सीजन नीचे पहुंचाई जा रही है। इसके साथ ही 1,27,000 नए ऑक्सीजन सिलेंडर का ऑर्डर भी 21 अप्रैल को प्लेस किया गया है, जो कि आने वाले 1-2 दिनों में उसकी सप्लाई भी शुरू हो जाएगी, जिसमें कि 54,000 जंबो सिलेंडर जी टाइप जो बोलते हैं वह हैं और 73,000 रेगुलर सिलेंडर जो बी टाइप सिलेंडर हैं वह सप्लाई किए जाएंगे।
Mr. Agrawal has informed that efforts are being made to import 3,500 metric tons of medical oxygen from various countries. He also informed that efforts have also been made to increase the availability of oxygen tankers.
फिजिबिलिटी ऑफ लैंड अगर स्टेट हमें देती है तो वहां पर हम पीएसए प्लांट लगाएं जिससे कि लोकली ऑक्सीजन का प्रोडक्शन हो सके। उसके तहत 162 प्लांट्स भी देश में सैंक्शन किए गए, जिसमें से 52 प्लांट अब तक इंस्टॉल हो चुके हैं, 87 प्लांट डिलीवर हो चुके हैं और त्वरित गति से उन प्लांट्स की कमीशनिंग का कार्य भी चल रहा है। प्रेशर स्विंग एब्जॉर्प्शन जो ये प्लांट पीएसए प्लांट जिनको हम कहते हैं, इनसे हमें इन सिटू जनरेशन ऑफ ऑक्सीजन यानी कि हॉस्पिटल स्थाई पर ही ऑक्सीजन जनरेशन की एक फैसिलिटी मिल सकती है। साथ ही हम स्टेट से ऑन ए रेगुलर बेसिस नॉट ओनली मिनिस्ट्री ऑफ हेल्थ, DPIIT और रिलेटेड ऑर्गेनाइजेशंस इंक्लूडिंग MHA के साथ मिलकर हम अवेलेबिलिटी और सप्लाई ऑफ मेडिकल ऑक्सीजन पर प्लान कर रहे हैं।
Amid the high demand of medical oxygen in the hospitals, the central government has advised the states to ensure rational use of oxygen. States have also been advised to undertake an oxygen consumption audit in the hospitals. Additional Secretary in the Home Ministry has said daily production of medical oxygen has been ramped up to 9,000 metric tons from the level of 6,000 metric tons within a span of 9 months. He said 7,500 metric tons are being supplied to states on a daily basis. He assured that sufficient stocks of liquid oxygen are available in the country. Over the rising cases of COVID-19 in the country, Mr. Agrawal said several states and union territories are registering higher number of cases, which has put a burden on the health infrastructure. He said the country is witnessing the second wave of COVID pandemic and states have been asked to strictly implement the guidelines and protocols to contain the spread of coronavirus.
The liberalized and accelerated Phase 3 of the COVID-19 vaccination drive will start tomorrow. Everyone above the age of 18 years will be administered the COVID-19 vaccine in this phase. The registration process for this phase is underway and over 2.66 crore people have registered on the CoWIN portal so far. In this phase, the vaccination will continue as before in the central government's vaccination centres free of cost to the eligible population, including healthcare workers, frontline workers and all people above 45 years of age. Meanwhile, Apollo Hospital and Max Hospital have confirmed their participation in the third phase of the COVID-19 vaccination drive. The two groups said the vaccines will be available at their limited hospitals in the country. Pre-registration on CoWIN portal or Arogya Setu is mandatory for the vaccination. A report.
During this phase, vaccine manufacturers will supply 50% of their monthly release doses to the central government and they will be free to supply the remaining 50% doses to the states as well as in the open market. The manufacturers of Covaxin and Covishield vaccines have already declared the price of vaccines that will be available to state governments and in the open market. Private hospitals will have to procure their supplies of COVID vaccines exclusively from the 50% supply earmark for other than the Government of India channel. Central government from its share will allocate vaccines to states and UTs based on the criteria of the extent of infection and the speed of administration. All vaccination will be the part of National Vaccination Program and mandated to follow all protocols such as being captured on the CoWIN platform. Divakar, AR News, Delhi.
Prime Minister Narendra Modi today asserted that all arms of the government are working unitedly and rapidly to deal with the COVID-19 situation in the country and urged union ministers to stay in touch with people of their respective regions, help them and keep getting their feedback. He stressed the need to ensure that issues at the local level are promptly identified and addressed. Mr. Modi stated this during the Council of Ministers meeting held virtually to discuss the situation arising out of the second wave of COVID in the country. The Council of Ministers noted that the present pandemic crisis is once-in-a-century crisis and has thrown a big challenge for the world. During the meeting, the Government of India's Team India approach to fight COVID based on the collective efforts of the centre and state governments and people of India was highlighted. The Council also reviewed all the efforts made in the last 14 months by the central and state governments and the people. It was also briefed about the efforts by the central government in coordination with the states towards building up infrastructure in the form of ramping up hospital beds, PSA oxygen facilities, resolving issues in production, storage and transport of oxygen, and tackling matters relating to the availability of essential medicines. The support measures to the vulnerable population in the form of provision of food grains and financial support to Jan Dhan account holders were also pointed out.
The Office of the Principal Scientific Advisor to the Government of India has released home care tips for managing mild symptoms of COVID-19. It has advised people not to panic if they experience any COVID-19 symptoms, as the majority of people can manage their infections at home by following self-care measures. They have been recommended that at the first sign of experiencing the symptoms, people should isolate themselves at home and begin following self-care measures. It is important to isolate, rest and keep hydrated and regularly monitor the patient's blood oxygen levels and temperature. The patient has to consult a doctor if the fever persists or if SpO2 levels fall below 92%. The guide also highlights the importance of keeping the patient's doors and windows open to keep the room well ventilated. The guide outlines the importance of getting vaccinated to reduce the spread of the virus. It also reminds people that even after being vaccinated, it is essential to continue to follow COVID-appropriate behavior. AIIMS Director Randeep Guleria has stressed that misuse of drugs must be avoided to effectively deal with coronavirus cases. In a media briefing in New Delhi today, Dr. Guleria suggested measures for the treatment of patients with mild asymptomatic diseases in home isolation.
अगर आपका बुखार जो है वो पैरासिटामोल जो हम कहते हैं कि आप 650 मिलीग्राम दिन में 4 दफा ले सकते हैं, उससे कम नहीं हो रहा है, तो अपने डॉक्टर से संपर्क करें और आप दूसरी कोई दवाई जिससे बुखार कम हो सकता है, जिनको हम कहते हैं नॉन स्टेरॉइड एंटी इन्फ्लेमेटरी ड्रग, जैसे नेप्रोक्सोन है या इब्यूजेसिक है, उस टाइप की दवाई भी ले सकते हो जिससे आपका बुखार कम हो जाए। क्योंकि कई मरीज ऐसे हैं तो ये कहते हैं कि पैरासिटामोल से उनका बुखार नीचे नहीं आ रहा, अभी भी 101, 102 पे है, तो तब अपने डॉक्टर से संपर्क करके दवाई थोड़ी चेंज कर सकते हैं। हम ये भी एडवाइस करते हैं कि आइवरमेक्टिन जो एक दवाई है वो रोज एक गोली ले सकते हैं 3 से 5 दिन के लिए। इस दवाई की रिकमेंडेशन बेस्ड ऑन डिस्कशन जो नेशनल टास्क फोर्स और जॉइंट मॉनिटरिंग ग्रुप की मीटिंग में हुआ था, जिन्होंने सारा डेटा एवेल्युएट करके ये पाया था कि शायद इस दवाई से थोड़ा बहुत फायदा हो सकता है और इसलिए ये होम आइसोलेशन की गाइडलाइंस में डाली गई हैं।
On the use of remdesivir, Dr. Kuleria said it must be administered in the hospital on the advice of medical professional. He cautioned people to avoid administration of remdesivir at home as it can be harmful. He advised to seek medical support in the case of difficulty in breathing, dip in oxygen saturation below 94 in room air and persistent pain in the chest. He said there is no need for testing after the home isolation period is over.
रेमडेसिविर जो है वो सिर्फ हॉस्पिटल में ही लेनी चाहिए। उस दवाई के अपने साइड इफेक्ट्स हैं, उसके अपने इंडिकेशन है, इसलिए वो घर पे बिल्कुल इंडिकेटेड नहीं है। और इसलिए मैं यही फिर से कहना चाहूंगा, लास्ट टाइम भी ये कहा था कि रेमडेसिविर जो है वो होम बेस के लिए, होम आइसोलेशन माइल्ड और एसिम्प्टोमेटिक पेशेंट के लिए बिल्कुल उसका कोई फायदा नहीं है, उससे नुकसान भी हो जाता है। इसलिए घर पे रेमडेसिविर बिल्कुल ना लें। अगर आपको लगे कि आपकी सैचुरेशन जो है वो कम हो रही है, 94 से कम हो रही है, 90 के पास आ रही है, या आपको सांस चढ़ रहा है, आप खुल के सांस नहीं ले पा रहे हैं, तो एकदम डॉक्टर से कंसल्ट करें, वो बहुत जरूरी है, जिससे आपको समय पे ट्रीटमेंट मिल जाएगा और अगर एडमिशन की जरूरत है तो समय पे ट्रीटमेंट हो जाएगा।
Amid the COVID-19 pandemic, the government today provided relief to the people by permitting import of oxygen concentrators for personal use through post, courier or e-commerce portals under gifts category. The permission has been given till 31st of July this year. The Directorate General of Foreign Trade has issued a notification in this regard. The centre has started importing the vital drug remdesivir from other countries to ease out the shortage of it in the country. The first consignment of 75,000 vials will reach India today. The Ministry of Chemicals and Fertilizers said HLL Lifecare Limited, a Government of India-owned company, has ordered 450,000 vials of remdesivir from a company of the USA and the Egyptian pharma company.
The total number of active cases of COVID-19 in the country further swelled today to comprise nearly 16.90% of the total reported cases. The Health Ministry has informed that currently over 31,70,000 people are reported to be suffering from the viral pandemic and are either hospitalized or under home isolation. In the last 24 hours, the nation registered nearly 3,86,000 new COVID cases. With this, the recovery rate has further slipped to 81.99%. Over 2,97,000 people have been discharged from hospitals or are reported to have been completely cured since yesterday. 3,498 COVID-related deaths were reported in the last 24 hours. Cantonment boards have extended a helping hand to civil administration and state governments in various parts of the country to tide over the current COVID-19 situation. They are providing support not just to its residents but to all those in need of medical assistance. Presently, 39 cantonment boards are maintaining 40 general hospitals with 1,240 beds.
You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. Health and Family Welfare Ministry says government has taken steps to ensure supply of medical oxygen for COVID patients in the country. Prime Minister Narendra Modi asserts all arms of the government working unitedly to deal with COVID-19 situation in the country. Urges union ministers to stay in touch with people of their regions and help them. Government permits import of oxygen concentrators for personal use. Principal Scientific Advisor to the Government of India releases home care tips for managing mild symptoms of COVID-19. Bihar government to give special pension to family of those government officials who died due to COVID in the state. Over 15 crore 22 lakh COVID-19 vaccine doses administered in the country so far. More than 2,97,000 people recover from the COVID-19 in last 24 hours. Nearly 3,86,000 fresh cases of COVID-19 registered in the country. Andhra Pradesh plans to provide over 32 lakh tap water connections in the current financial year under Jal Jeevan Mission. 44 people killed in a stampede at a religious gathering in Israel. And an IPL cricket match between Punjab Kings and Royal Challengers Bangalore underway at Ahmedabad. For quick news updates on the clock, follow us on Twitter at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो खुद से वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back to the evening news. The Bihar government has taken decision to give a special family pension to those government officials who died due to COVID infection in the state. This decision was taken at a cabinet meeting which is chaired by Chief Minister Nitish Kumar. It may be noted that a number of government officials died due to COVID complication in the recent past. Meanwhile, Bihar's Chief Secretary Arun Kumar Singh succumbed to a multiple organ failure after testing positive for COVID-19 at a hospital this afternoon. He was admitted more than a week ago after he developed complications in breathing. Mr. Singh was a 1985 batch IS officer of the Bihar cadre and took charge as a Chief Secretary on February 27th this year. Kerala continues to report surge in COVID cases as 37,199 new COVID cases were confirmed today. The test positivity rate is at 24.88%. Also, 49 COVID deaths have been reported, taking the death toll to 5,308. Presently, over 3 lakh active COVID cases are there in the city.
The Railways has delivered more than 664 metric tons liquid medical oxygen to Maharashtra, Uttar Pradesh, Madhya Pradesh and Delhi. The Railway Ministry said 174 metric tons of liquid medical oxygen have been delivered to Maharashtra, more than 356 tons to Uttar Pradesh, over 47 tons to Madhya Pradesh and 70 tons to Delhi. India's vaccination drive against COVID-19 continues with added momentum and has crossed the cumulative tally of over 15 crore 22 lakh doses so far. In the last 24 hours, more than 22 lakh 24,000 doses of COVID vaccine were administered. The Health Ministry has informed that in a span of 104 days since the beginning of the vaccination drive, more than 12 crore 54 lakh people have received the first dose of the vaccine and more than 2 crore 67 lakh people have been fully vaccinated with both the required doses. The third phase of vaccination drive is starting from tomorrow when everyone above the age of 18 years will be eligible to take COVID vaccine. On the third day today, since the registrations open for third phase, more than 2 crore 45 lakh people have registered themselves. Citizens in the age group of 18 to 44 years can register themselves in the COVID vaccination program through cowin.gov.in platform or also through Arogya Setu app.
Sikkim continued to report its highest daily spike in COVID-19 cases for the third consecutive day, with 205 new cases today. The state had reported 170 cases yesterday and 151 cases on Wednesday. A total of 915 cases have been recorded this week, and 1,717 cases have been recorded this month, taking the state's COVID-19 case tally to 7,952. The state currently has 1,432 active cases. A report.
Of the new 205 COVID-19 infections, East Sikkim district reported 183, taking the total cases to 6,048. North Sikkim reported 10 new cases with a total of 107 cases, while West Sikkim recorded 8 new cases, taking the district tally to 440 cases. South Sikkim recorded 4 new cases to take total cases to 1,179. 19 recoveries were also recorded in the state in the last 24 hours. With Saikat Sarkar, Pankaj Tungel from Gangtok for AIR.
The Gujarat government will launch a vaccination drive for the 18-plus age group from tomorrow in 10 districts. According to an official press release, Chief Minister Vijay Rupani will launch the vaccination drive for 18-plus group on the occasion of Gujarat Foundation Day tomorrow. More from our Ahmedabad correspondent.
Gujarat Chief Minister Vijay Rupani will launch the free vaccination drive against COVID-19 for 18 plus age group from tomorrow. Official sources said that initially the drive will be launched only in 10 districts. The people of the concerned age group have been asked to register themselves through an online portal as there is no provision for spot registration. The 10 districts in which the vaccination drive will be launched are Ahmedabad, Surat, Vadodara, Rajkot, Bhavnagar, Jamnagar, Kutch, Mehsana, Bharuch and Gandhinagar. Gujarat government has already ordered 2 crore 50 lakh doses, out of which 3 lakh doses are reaching Ahmedabad by air. Yogesh Pandya, AR News, Ahmedabad.
In the Union Territory of Jammu and Kashmir, all 20 districts in Jammu and Kashmir are under complete lockdown and strict restrictions, as the remaining 9 district administrations have also imposed complete lockdown effective from this evening until 7 a.m. on Monday. The vaccination drive for the age group of 18 to 44 years in Jammu and Kashmir has been deferred till at least up to for 15th of May.
On the occasion of the 151st birth anniversary of the father of Indian cinema, Dada Saheb Phalke, the National Film Archive of India, NFAI, has published a rich treasure of audio recordings in the public domain. A report.
About 8,000 minutes of interviews of veteran film artists from the Indian film industry are now made available on the NFAI website. Starting from the silent era of Indian cinema, these are the fascinating tales of journeys of actors, technicians, producers, directors and studio owners. Conducted mostly in the 1980s, these interviews were recorded as part of the Oral History Project of NFAI's research program and features long interviews of pioneering film personalities narrating their experiences about their life stories and anecdotes from the world of cinema. In this treasure, there are 53 interviews of film artists conducted in 5 languages: Marathi, Tamil, Telugu, English and Bengali. The artists include who's who of the Indian film industry, including J.B.H. Wadia, Akineni Nageshwar Rao, Vijay Bhatt, P. Bhanumati, S.D. Subbulakshmi, M.K. Radha, P. Leela, C. Honnappa Bhagavathar, Zunzarao Pawar, Dada Salvi, Chandrakant Gokhale, R.M. Krishnaswamy, S.V. Venkatraman, R. Ramamurthy, K.S. Prakash, V. Gopalakrishnan, R.B. Lakshmi Devi, Shahu Mudak, E. Mohammed, V.V. Bapat and Saumitra Chatterjee, apart from others. These long interviews not only throw light on the personal journey of these artists, but also give an in-depth account of the changes in the Indian film industry over a long period of time. One can click on NFAI website to listen to these recordings. With Nitin Kelkar, Ravi Kumar for AIR News, Delhi.
गर देने की दे दे कुछ चाहे अगर तो मांग ले मुझसे चाहे अगर तो मांग ले मुझसे हिम्मत है गर लेने की ले ले.
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion program on COVID-19. Dr. K. Srinath Reddy, President, the Public Health Foundation of India, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by using hashtag AskAIR. Andhra Pradesh has planned to provide 32,47,000 tap water connections in the current financial year under the Jal Jeevan Mission. The Jal Shakti Ministry said Andhra Pradesh today presented its Jal Jeevan Mission annual action plan through video conference. The state has 95,66,000 rural households, out of which around 45 lakh already have the tap water supply. The ministry said the Andhra Pradesh government aims to make 13 districts and more than 17,000 villages Har Ghar Jal in the current financial year. The Jal Jeevan Mission is a flagship program of the central government which aims to provide piped tap water to every rural household by 2024.
President Ramnath Kovind and Prime Minister Narendra Modi have expressed grief on the demise of popular news anchor and senior journalist Rohit Sardana. In a tweet, Mr. Kovind said his untimely demise is a huge loss for the world of journalism. He expressed condolences to the family and admirers of Mr. Sardana. Mr. Modi said Rohit Sardana left us too soon. He said, full of energy, passionate about India's progress and a kind-hearted soul, Rohit will be missed by many people. External Affairs Minister Dr. S. Jaishankar today spoke to U.S. Secretary of State Anthony Blinken and discussed the Indian requirements to address the COVID challenge more effectively. They reviewed the flow of equipments and materials coming from the U.S. In a tweet, Dr. Jaishankar said they highlighted the importance of strengthening oxygen supply, expanding vaccine production, and increasing remdesivir supply. He also appreciated the forthcoming response of the U.S. in this regard.
In Israel, 44 people were killed in a stampede that occurred at a religious gathering at Mount Meron today. The tragedy struck when a large number of Jewish pilgrims had gathered at the site of the reputed tomb of Rabbi Shimon Bar Yochai, a 2nd century Talmudic sage. Police sources told the local media that it started after some attendees slipped on steps, which caused dozens more to fall. Authorities say at least 44 people have been killed and about 150 injured. Police have launched their own investigation. Reportedly, 3 times more participants, including children, had gathered than authorized by the police, leading to the worst civilian disaster in Israel's modern history. External Affairs Minister Dr. S. Jaishankar has expressed sadness on the tragedy at Mount Meron in Israel during the celebrations of Lag BaOmer. Dr. Jaishankar extended condolences and wished the injured a speedy recovery. The government has instituted an award to recognize excellence in cinema in the name of Satyajit Ray. Satyajit Ray Lifetime Achievement Award will be given from this year at the International Film Festival of India. In the IPL cricket, Punjab Kings were 129 for 5 in 16.2 overs against the Royal Challengers Bangalore at the Narendra Modi Stadium in Ahmedabad when reports last came in. RCB captain Virat Kohli won the toss and chose to field. The two teams are facing each other for the first time in this season. In all, both the teams have faced each other in over 26 matches in IPL, out of which Punjab has won 14, while RCB has won 12.
Now let us take a look at the weather forecast for tomorrow. National capital Delhi is expected to have partly cloudy sky with possibility of development of thunder lightning. Minimum temperature will be around 24 degrees Celsius. Maximum is expected to hover around 39 degrees. Mumbai will also have partly cloudy sky with possibility of development of thunder lightning. Minimum temperature will be around 26 degrees Celsius and maximum around 35 degrees. Chennai will have partly cloudy sky with minimum temperature touching 28 degrees Celsius and maximum expected at 37 degrees. Kolkata will have partly cloudy sky with possibility of moderate rain or thunderstorm. Minimum temperature in the metropolis will be 28 degrees while the maximum is expected at 36. In Jammu, the sky will be mainly clear, becoming partly cloudy towards afternoon or evening. Minimum temperature will be around 23 while maximum will rise up to 39. Srinagar will have mainly clear sky, becoming partly cloudy towards afternoon or evening with minimum of 11 degrees Celsius and maximum of 28 degrees. Leh will have partly cloudy sky with temperature hovering between 3 degrees to 17 degrees Celsius. In Gilgit, minimum temperature will be around 10 degrees Celsius and maximum is expected at around 33 degrees. The region will have mainly clear sky. In Muzaffarabad, temperature will be shifting from a minimum of 15 degrees to maximum of 37 degrees. Sky will be mainly clear, becoming partly cloudy towards afternoon or evening. Chandigarh will have partly cloudy sky tomorrow with temperature hovering between 22 to 41 degrees Celsius. Dehradun will have partly cloudy sky with possibility of development of thunder lightning. Temperature will move from minimum of 20 degrees to maximum 38 degrees. In Hyderabad, rain or thunder showers would occur towards evening or night. Temperature will vary between 25 to 39 degrees Celsius. Patna will have partly cloudy sky with minimum temperature expected around 24 degrees Celsius and maximum reaching up to 39 degrees. Guwahati will have generally cloudy sky with 1 or 2 spells of rain or thunder showers. Minimum temperature will be around 21 and maximum will be 33 degrees.
And now, before we end the bulletin, the headlines once again. Health and Family Welfare Ministry says government has taken steps to ensure supply of medical oxygen for COVID patients in the country. Prime Minister Narendra Modi asserts all arms of the government working unitedly to deal with COVID-19 situation in the country, urges union ministers to stay in touch with people of their regions and help them. Government permits import of oxygen concentrators for personal use. Principal Scientific Advisor to the Government of India releases home care tips for managing mild symptoms of COVID-19. Bihar government to give special pension to family of those government officials who died due to COVID in the state. Over 15 crore 22 lakh COVID-19 vaccine doses administered in the country so far. More than 2,97,000 people recover from COVID-19 in last 24 hours. Nearly 3,86,000 fresh cases of COVID-19 registered in the country. Andhra Pradesh plans to provide over 32 lakh tap water connections in the current financial year under Jal Jeevan Mission. 44 people killed in a stampede at a religious gathering in Israel. And an IPL cricket match between Punjab Kings and Royal Challengers Bangalore underway at Ahmedabad. For details of these stories and more, log on to our website newsonair.com and News on AIR app. And with that, we end the evening news. Good night.